Recent study out of Cedars-Sinai Hospital suggests that there is a link between COVID-19 patients and an increase in heart attack deaths, most significantly impacting younger adults. So joining us live to dive deeper into these figures is cardiologist Dr. Christopher Overgaard. Dr. Overgaard, thanks for joining us this morning.
Thanks for having me this morning.
Can you break down what you are seeing with this study and what you've seen on a personal level when it comes to people who have been infected by COVID-19 now dealing with heart attacks and resulting in death?
So we've known from the very beginning, like I would say within about 4 or 5 months of COVID starting, that myocardial involvement was actually a very important part of the problem. Some of the original studies from Wuhan, China, showed a spike in cardiac-related deaths in patients that had COVID, and that was well before we had a vaccine. On a personal level, we have noticed an increase in events in young people, and we can't always say it's necessarily because of COVID, but there seems to be an increase in the landscape since COVID started.
And I want to clarify, too, we know that there are a lot of people who have been condemning the vaccine, anti-vaxxers who are linking the vaccine to heart attacks and to heart events. That is not the case. That is not what this study is saying.
No, not at all. No, this study is basically saying that if we compare pre-pandemic levels, heart attacks were actually going down, and then they dropped precipitously right after COVID started, only because people were not presenting to hospital. And then when they started to come back, partly due to public relations campaigns, we noticed that the spike starting to go up, and we're seeing lots of young people. And a lot of this happened before the vaccine was even mainstream. What we've noticed with the vaccine, of course, is that COVID severity is decreased immensely.
Now, I understand the risk as well with this is not just limited to heart attacks when it comes to COVID-19 infection. There are other concerns that you're seeing on the rise as well.
That's right. There are a lot of heart attack mimickers, which we have seen as well. COVID can cause an increase in inflammation in the body. And there's some theory that if you have underlying risk factors for heart disease, such as high blood pressure, high cholesterol, diabetes, that COVID may speed things up a little bit. And so if you were going to have problems later, you may be having them a bit earlier as a result.
Okay, so a bit accelerated there. Is there any indication why you're seeing younger adults being impacted significantly?
Well, I guess it's a confluence of events, like I said. So younger adults that have diabetes, for example, they may not know they have diabetes, and all of a sudden they get COVID. It may increase body inflammation. They present to the hospital with classic symptoms. And it's on the medical professionals as well to widen the net and look at younger people with a bit of a closer eye. People that we wouldn't assume would normally have heart attacks, we have seen.
All right. And anything that we can look for in terms of a warning sign, something that we may see leading up to what could potentially be a life-changing heart attack?
Yeah, so it's always amazing to us on the front lines when we see somebody that's having a heart attack. We talk to them at the very beginning and we say, have you had any symptoms? And they tell us that they've actually been having symptoms for 3 months, 6 months leading up to it that have been slowly accelerating. And so when you start feeling chest pain when you're walking upstairs or walking down the street, that's the time to actually seek medical attention so that we can try to catch things earlier before it becomes a full-blown heart attack.
And is there a difference between the signs that a woman may see versus a man?
Yeah, that's always been a really interesting question. In fact, women can present a little more atypically, so we widen the net again. We think about them having more, for example, back pain, shoulder pain, pain that isn't necessarily classic crushing chest down the arm in women.
All right. And is there anything that you can do to be preventative? Yes, you can get the vaccine. Is there anything else that you can do, especially now when COVID is not as prevalent, but it's still out there and is still infecting people?
Well, I tell people to try to be as healthy as they can be. So that means get your cholesterol checked. Make sure your blood pressure is in line. Exercise. It sounds obvious. Some of these are grandfather statements, but they're very important. And a lot of people actually became very sedentary. They didn't do much during COVID, and they also were very stressed about COVID. So those didn't help at all as well. So now's the time to get back out there and try to get yourself in as good a shape. And it's pretty much a guarantee that if you are in good shape, you're going to weather COVID better, and your heart event would be less than it would be if you weren't.
Okay, good advice. Thank you so much again. That's cardiologist Dr. Christopher Overgaard. Thanks for joining us.
Thank you.